Yeah, I start with the basic fundamental principle first of asking all these cells that are injured and are damaged, they're trying to heal. You're also trying to make new ones, heal the ones that have been damaged and make new ones. That's called recovery, regeneration, and resiliency. So, what I do for my concussion people is I open up the flow routes for the whole body by working from the collarbone up and the collarbone out. And that's why I figured out that massages and stuff and regular therapy doesn't work.
Dr. Nickelston, welcome to the podcast.
Thank you so much. And please call me Perry. I appreciate that. Great to be on the show.
Perry, wonderful to have you on. I just want to go into your history and how you eventually went down the rabbit hole that is called the lymphatic system.
Yeah, I'd be happy to. I first want to say how much I know we're talking a little bit before we started recording, how much I enjoy your work, been following your work and the things that you're doing to help people with their brain recovery, regeneration, things like that. So keep up the great work.
Thank you.
Yeah, it really ties in nicely to the work that I do now because I got into lymphatic system honestly not by choice because yeah, I've been in healthcare for 30 years, coming up on 30 years now, which I can't believe I actually have to say that number. Um, but I started off in more of the musculoskeletal realm, being a practicing traditional chiropractor for many, many years.
Mhm.
And then that led me to branch out into other areas, looking at fascia. And then I began to look at movement. And then, of course, the nervous system, what we do for the spine. But we really never looked at the brain, honestly,
Hmm.
as chiropractors. I mean, maybe cervical one, cervical two, the atlas and axis, because that's a big powerhouse up there that can affect that upper cervical complex. And, that'll make your brain go sideways quick, fast, in a hurry.
Yeah.
But I was just not thinking of the brain at that standpoint. But I was honestly always looking for answers of why people started to have issues in the first place and why, more importantly, why stuff always came back. Like no matter what we did, everything would keep coming back. And I said, man, the body's way smarter than that. We got to be missing something, right? But
Yes.
you know how you may not be in the right space in your life or your right way of thinking, and you're not. It's there, but you're not seeing it, right?
Right.
And we learn through discomfort, usually like a lot of it,
Yeah.
and because that motivates change, which is
Hmm.
what pain does. And I ended up getting a lot of autoimmune type disorders. Systemic, as you know, means full body. Some people might not know that. So everything on my body just was an inflamed hot mess. And no matter what I was doing to try to help myself from my current model of thinking and everything that I learned up to that point was making a difference. And if it did, it didn't stick. And then I sought help from other people and they weren't having any luck either. Right. And some of it was because I just had a similar circle. You know what I mean? You didn't hang out
Right.
with the same kind of people, the same thinking process.
Yeah.
But I had to think that there's something I'm missing, man. Like it's gotta be there. And that answer for me ended up being the lymphatic system, which I never ever focused on at all. Because in my mind, the lymphatics come into play when you have cancer, for sure. But when you have lymphedema, which is dysfunctional lymphatic valves and body parts become really, really super duper swollen. But I didn't look at it in relationship to anything else. Yeah. But once I went down that road, somebody else introduced me to it. And then I was like, holy cow, that might be it. And I knew it was it for me because after 3 days of doing lymphatic focus treatment, I made more improvement in 3 days than I had in about 8 to 9 months of
Hmm.
anything else. And the thing that really blew my mind was it was the only thing that made a change in my brain fog. my neuroinflammation that was just taking me out. That was one of the biggest things that scared me because I couldn't use my brain anymore. I actually had to stop practicing and
Oh.
stop teaching because I couldn't think and I
Mhm.
couldn't remember anything. Right. And when that made a change in there, I'm like, how in the world did that happen? What's going on here? So that I took a deep dive into the lymphatic system. And
Mhm.
then, of course, that's when I learned that there's no such thing as just one system, that they're all working together. And within a year, I was pretty much healed, if you want to say that. I don't say cured because cured implies you're never going to get something again, and you certainly can.
Right.
So you have to keep yourself managed or maintained.
That's really fascinating. I wanted to know, like, I love how it was something that you tried and immediately was effective, and you were like, "Well, I'm on to something here because
Hmm.
something feels good about this, and I'm getting results." I'm so curious of what is the history of the study of this? Where is there a way that we can like derive who is the founder or like founder, quote unquote, or whatever that discovered about the lymphatic system?
Yeah, that's a great question. Um, One of the primary resources that I learned a lot from it was the medical doctor at the time who created his own discipline known as osteopathic medicine, traditional osteopathic medicine. And that was Andrew Taylor Still. And he talked a lot about the fluid systems of the body, which is honestly the biggest thing that I focus on right now in my career without question. That's it.
Mhm.
And he talked about the flow of the lymphatics, the reservoir of life, he called it. And he said life and death is based on the flow of your lymphatics and also the arterial side, the nutrition side. So he said the role or rule, so it depends on who you read, the artery reigns supreme. And then you realize he's talking about the same system because the lymphatic system is a significant part of your vascular system. They always go together. You can't
Right.
have a problem with one while having a problem with the other. So that was how it was on the radar.
Hmm.
But if you go back, I mean, there were doctors and physicians and researchers and anatomists that were coming on to lymphatics, even the ones that they're talking about now as newly discovered, meningeal lymphatics. There's a dude from I think it was like the 1500s or 1600s who was an Italian who said, been there, done that. It was there, but nobody believed him. And he was, of course, vilified, like a lot of people are, and then circle back all these years. Oh, well, he was right. It's there. So, yeah, lymphatics have been around for a long period of time, but nobody ever paid attention to them. They just disregarded them as no big deal.
Hmm.
And they used to do that with fascia too. I mean, there was a time that nobody even knew what in the world fascia was or meant, and anatomists would just cut right through it to get to the quote unquote good stuff. That is the good stuff, right? So
Right.
now everything is about fascia, fascia, fascia.
Right.
And I think that we're going to have the same thought process with lymphatics, and we're going to go to ourselves, how in the world did we overlook this stuff for so long? And the research, I believe, now will significantly start to accumulate, and they'll see how it relates to all the other systems. Very similar, honestly, to how much progress has been made in brain research. I mean, you know better than anybody that over the last 10 years, I think that we've learned more about the brain than the last 1,000 years because one, we're starting to pay attention to it, and technology changes so you can see things you didn't normally see before, including the lymphatics around the brain. And they'll learn the same kind of things, I believe, in relationship to lymphatics.
Interesting. What really comes to my mind with the lymphatic system is you and I are probably uh, some of the most heavily tattooed doctors around.
Yep.
And which is funny because I've had people come up and that's how I got reintroduced to your work was they were like, you're tattooed and that's going to influence your lymphatic system, just random messages. And I'm
Mm.
like, yeah, I have these tattoos. What are your thought process around that? Because I notice you have some too.
Yeah, I mean, hey, and guess what? The little thing is once you get them, you can't unget them, right?
Right.
So
Yeah.
they're there. And I have people say that all the time, like, you know what that's doing to your lymph. And I'm like, I realize that, but what do you want me to do about it now? So I got most of these tattoos before I really learned about lymph, and some I got after
Yeah.
lymphatics, right? But so that maybe that's actually one of the reasons why I do lymphatics now, because I know that my lymphatic system is really being overburdened by wearing a lot of ink.
Hmm.
Okay. So
Yeah.
ink is going into your system and it stays there. It doesn't just disappear. So it
Right.
slowly bleeds in all the time. And you've got a lot of lymphatics underneath that skin. So they're going to go into your lymph. And from the lymph, they travel everywhere. Now, I don't think they know enough yet, honestly, in relationship to tattoos.
Yeah.
What, if anything, that's doing to the lymphatic system to cause it to become dysfunctional or overwhelmed or caused inflammation. I do believe the human body is pretty damn resilient overall.
Yeah.
And a lot of that will come down, honestly, to the type of ink that you're using and the skill of your artists and all those sorts of different things. But
Yeah.
I've interviewed a neuroscientist on my podcast a few times. Her name is Dr. Claudia Aguirre, and she does a lot of work with skin and the brain,
Hmm.
because there's a big connection there, as you know, through the
Yeah.
ectoderm, right?
Mhm.
And she said that when they do cadaver type studies, they do see that the lymphatics are black. So it's in the system,
Yeah.
right? And
Right.
traveling around.
Oh, okay. Okay.
What that does, who knows? Okay. I think that's the remain to be seen type of thing. But here's the thing, man. You can't reflexively say that you're going to have all these issues when you have tats, because I have a lot of people who are loaded up with tats and they don't have a lot of chronic disease or autoimmune disease or neuroinflammation, or their lymphatics at least appear not to be puffy, swollen, or tender. I have
Right.
some people that don't have a lick of ink on them and they can barely get out of bed and they're a hot mess. You, it's very individual. You can't
Right.
just say because you have this, you're going to have that. That does not exist.
No.
Buddy.
And I think that's a big problem in today's medical world is A plus B equals C. And that type of thinking process can put people really in a lot of issues because they're like, oh, you have this correlation with this, causation with this, yada, yada, yada. And so you are doomed. And so these doctors, unfortunately, I call it the indoctrination of the system.
Yeah.
They don't even know that they're being programmed to do so, even though they're some very well-meaning people most of the time. Right.
Yeah, see, that's the thing. I mean, they're in the matrix, and some of them don't even know they're in it, and other ones know they're in it, and they don't care. They want to
Right.
stay there. But I'll be honest with you, and when it comes to the human body, I don't believe the A plus B equals C most of the time. A plus B can equal 5. It can do whatever the hell it wants. It doesn't have to be a letter either.
Yeah.
So that's kind of like the reductionist thinking that modern medicine goes through to break things down into individual parts and like a single cell in a petri dish that's nothing like it when you put it into a body with a trillion other ones.
Hmm.
So when they do something to this cell A and then they watch what happens to it over here with B and then they get a C. That's
Hmm.
linear. But the human body is non-linear. It'll go in a circle and it'll zigzag and it'll go backwards if it wants to. So when you put that cell in with trillions of other cells, it's non-linear. And
Hmm.
that's why I think we're lost in the way that we're approaching chronic disease, because there is no single cause of anything. Like
Right.
That's why trauma care is easy. If I stab you with a knife, I know why you are bleeding and I know why you're hurt.
Yeah.
That's pretty simple, honestly. I mean, they want to put that together and save your life, right?
Mhm.
But what happens if you have something that just showed up magically today, no knife, and it wasn't there yesterday? You cannot treat the person the same way with the same thinking process because you're not going to get the same results. And that's why the brain is so important because it's honestly not even about the tissues of the body. It's how your brain is interpreting the signals coming in from the tissues and the story it tells itself about those tissues that changes the outcome. So the individual human being changes the outcome based on their own brain and their own brain history.
Yep. Yeah, no, there's no doubt about that. I mean, if somebody shoots you in the head, obviously you're not going to be around for very much longer. I mean, that's how important the brain really is. I wanted to know about the lymphatic system, and is there a connection, or what is the connection with the glymphatic system in the brain? Because they rhyme.
Yeah. Well, I love anything that's got lymph anywhere in the names, you know. But here's the thing I also want to specify is that there's no separation between brain health and brain function and the rest of the body below it.
Right.
I mean, I have neuroscientists and brain researchers look at the brain, but they don't know a whole heap a lot of anything underneath it. And I know a lot of people that do stuff down here and they don't know anything up top. Okay?
Right.
So
Yeah.
these worlds have to talk to each other. You have to.
Hmm.
Okay. That's the first thing. And they used to believe that the lymphatic system didn't have anything whatsoever to do with the health of your brain. They thought the brain was an immune privileged organ, right? Right. I actually
Privilege, right?
laughed too.
Yeah.
I actually laughed too because I'm like, can't you just use like what's called common sense and think to yourself, do you really think that your body is going to just stop right at the neck for the primary system that keeps it clean?
Right.
Uh, I'd say no. Maybe you just got to look different and look harder because it was always there all the time. And then we ended up finding that with the meningeal lymphatics, they call it, around the covering of the brain. And we'll get to the new the new meningeal layer that they discovered recently as well.
Mhm.
But so you have what's called the peripheral lymphatics. They're usually peripheral outside the body.
Yeah.
Those can significantly influence the central nervous system lymphatics. They're going to be one unit. And that's why people struggle a lot because they end up having a lot of neuroinflammatory disorders in the brain because they have inflammation in the peripheral lymph nodes that nobody's looking at. And your immune system will flip its switch on whenever any uh, lymphatic lymph node has stuff going to it or trapped into it. So it's an all systems on
Yeah.
thing that happens, right?
Yeah.
So the central bridge that I tell everybody is you've got your brain up top, sits in that dark container, right?
Yep.
And then you have the torso below, right, from the collarbone below, but that conduit is your neck, is your cervical spine. Now that's some prime real estate there, my friend, because that's the only way that you're getting blood flow to and from your brain, first of all. So if something happens in that neck, you're in a heap of hurt.
Yeah.
But that's also where your what they call the deep cervical lymph nodes sit. So deep means they're in there.
Hmm.
Uh, Cervical is just another word for neck, and lymph nodes are many toilets throughout your body that flush waste and identify things that are trying to kill you and tell your immune system what it is so you can kill it first and you can get it out. So it'll kill, 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 and transport to the next lymph node and kill, 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 and then clean you up as much as it can. It doesn't clean it all up, but it gets a really big amount of that out. And then it will now be able to transport it out through the circulatory system so you can pee it out primarily, sweat it out, poop it out, breathe it out, your other detox organs.
Right.
But the deep cervical lymph nodes are your brain toilets. So your glymphatic system, which G is for glial cells that are in the brain, and you probably talk to your listeners a lot about that.
Mhm.
And then you have the meningeal lymphatics, and then you have your dural venous sinuses up there, the vein component. All I want you to know is this: those suckers are trying to head to the deep cervical lymph nodes. And then I'm going to ask you a very simple question. What happens if you have blockages, or maybe you've had removal of some of those lymph nodes in your neck if you've had surgeries, which I did about 25 years ago when I had thyroid cancer? We can cycle back on that one because that was the beginning of the journey and I didn't know it.
Yeah.
And if those toilets are backed up and they can't drain, where do you think all of that cerebral brain waste material goes?
It has to be, it's stuck.
It's stuck. It's not going anywhere. It's staying up there. And if it can't get out, then your body has to make a decision. What the hell am I going to do about this?
Hmm.
So it's going to try to take care of it as best it can through inflammation. Because inflammation also kills things and repairs things. It does both.
Right.
So inflammation to me is a strategy that your body's using to try to get you healed up because your toilets are stuck. Right?
Yeah. And believe it or not, what I don't even really truly understand what a headache is. Like I study the brain all the time and it's my passion and my pride, but
Yeah.
it's fascinating. I'm like, what is actually going on up there? I know we have nerves and we have cranial nerves and all that good stuff, but um, what are some strategies you give for people? Because I work with a lot of concussion survivors and
Mm.
brain injury survivors. What are like some strategies they can use to reduce headache pain, essentially?
Yeah. Great question. Yeah. So I like to kind of go about my overall thinking process when I approach the body because there's so much stuff going on. There could be so many possibilities. It can be absolutely terrifying and overwhelming and intimidating. You're like, where in the world do I start? Right? Uh, so for me, I start with the basic fundamental principle first of asking all these cells that are injured and are damaged, they're trying to heal. And you're also trying to make new ones, heal the ones that have been damaged and make new ones. That's called recovery, regeneration, and resiliency,
Hmm.
right? So then I said, well, okay, well, what does a single individual cell need? Because if I can answer that question, the other trillion with different names should probably behave the same way. And I went down to so many basic things that it's almost so simple it seems stupid. But when it comes to understanding physiology, you have to go simple first.
Yeah.
And to me, it came down to the environment that the cells are living in. Environment, the internal environment. Okay. And that's a fluid filled environment. That's
Hmm.
what you need to know
Yeah.
because you're mostly fluid. And so stuff actually has to get to a cell. And then the only way it's going to get to a cell is through the fluid, through the blood flow, right? So the blood flow into something is the transport of the raw materials that you need. Nutrients, oxygen's kind of a big thing,
Yeah.
right? Amino acids, things like that, which are protein building blocks. And when something leaves the vascular system, it goes into another fluid. And that fluid is the interstitial fluid in the interstitium, which is the environment that the cells actually swim in. Right? And what controls the health of that fluid are lymphatics. The lymphatics keep that fluid clean, period. That's it. So it has to go into that fluid, then it's got to go into the cell. So your cell takes it in, and then it uses whatever went in, and it creates a metabolic process, which is an energy cycle.
Mm-hmm.
The Krebs cycle primarily through the mitochondria. So whenever you create energy, what do you always make? Waste. And now the waste has to go out. And then I'm going to ask you a question. How does that get out? And then your next answer should be lymph. Yes, exactly. So the cells poop. I call it cell poop, metabolic processes. And that takes it out through the lymph, and the lymph slowly starts to kill all those things. Okay, node to node to node. Then it's going to dump itself back into the vascular system in the veins. So it ultimately goes back to the veins. Then the veins go back into the heart. Then the heart takes it out through the arteries, and the artery delivered it to the other organs so it can go out. You can pee it out, for instance. Now, why? You're like, why are you telling me all that when I asked a question about concussions? Because what happens if you damage a brain cell? Well, you're going to have inflammation and then as swelling and edema. And then I'm going to ask you, what's the system that gets rid of inflammation, swelling, and edema? Well, it's lymph. Mm-hmm. It's lymph. Okay. So what happens if you've got a lymphatic system or vascular system that's compromised? It's going to be really difficult to heal from any concussion protocol I give you, right? It's going to be really difficult to get the best results from your brain exercises when your brain is living in waste. Mm-hmm. It's really hard.
Yep.
Right?
Yeah.
So you have to get the fundamental underlying transport chain, supply chain, I call it, to even function. And here's what many people don't understand is that it's the state of your vascular system and your lymphatic system before your concussion that will determine how well you recover from your concussion. How many working parts do I have before I got my trauma? And you know better than anybody, if I give you a concussion more than once, your likelihood of getting neuroinflammation or degenerative disorders skyrockets.
It does.
And I'm going to say, I think why is because you had a toilet clogged before you got your initial hit. And then I clogged you even more. And then things were backing up. And then I hit you again. And your brain is like, hey, man, I got nothing left. What do you want me to do here? So the answer to your question is my number one thing that I always do, always, is open up the primary fluid flow routes of the body that get stuck, twisted, congested, that slow down flow first before I do any other type of rehabilitation. So, because then I'm making it easier for your body to do what it's trying to do with the necessary supplies to do it. And I thought to myself, maybe that's what I've been looking for all along, of like, maybe people are not getting better from the work that I'm doing because the body can't do what I'm asking it to do because it doesn't have the supply chain to do so. Right. And then that's where my light bulbs went up.
Yep.
Because then I'm thinking to myself, okay, well, fluids move through movement, and fluids move through pressure. Like, so when you touch a tissue or you give somebody a massage, you're moving blood and you're moving lymph, right? And see, I never thought about that when I was treating these areas before I got my immune disease, because I was just thinking I'm working fascia.
Mm.
not realizing that, hey, man, underneath there, you got lymph too. But then here's the question. People say, well, doc, if I'm doing all these massages and I'm doing all this stuff, shouldn't that be enough to move my lymphatics?
Hmm.
Well, yeah, should be the answer, but
Yeah.
sometimes the blocks are really, really deep and you got to go very far in the body. Right? And maybe you just don't know where the blocks are. But then this is when it really hit home, man. When I started to look at fluid dynamics in the body with the physics property of fluid flow called hydrodynamics. Fluids just don't move somewhere by accident. There's always a reason why it goes there. And it works based on pressure. And this is going to cycle back to your initial question in a moment.
Sure.
Right? So when you understand how lymphatics flow and veins flow in particular, is that they're always going to flow from high pressure to low pressure. They're always looking for the low because it takes less energy to do that.
Right.
And then I thought to myself, well, where's the lowest pressure? Once I looked at the lymphatic thing, where is the lowest pressure for vein flow and lymphatic flow located in the body? That's the collarbone. Okay. That's where everything is trying to go. Operative word, trying. So if we know that's the lowest pressure, let's extrapolate out by our thinking process, where would the highest pressure locations be?
Naturally.
Exactly. Up.
Gravity. Yep.
So you're really going to have a lot stuck in your head,
Yeah.
your hands and your feet.
Those are the highest pressure sources right there.
Yeah, because they're the furthest away from the drain point, and you also have to fight gravity.
Hmm.
That's why your hands and your feet swell up so easily when you have vein issues and lymph issues, because the fluid flow pools, right? So everything's trying to go towards the collarbone, including your brain. Okay? So if your collarbone has a tightness or a tension or a blockage or a restriction in there, which if you're live on this earth, the answer to that question is yes, it does.
Yeah.
Okay. It just depends on how bad.
Hmm.
That fluid flow can't get out. It's going to get out because if it didn't get out, you'd be dead. But it's going to get out slow over time. Drip, drip, drip. Day after day, week after week, year after year. And then that's when yesterday I didn't have brain fog. Today I do. Okay. So then I asked myself, if the fluid can't go to the collarbone, where else does it go? It goes back. It backflows. It backflows down, but it also backflows up. And then so the fluids stay up here. And what that is like having a dirty sink stuck full of fluid. And all you do is stick your hand in there and swirl around the sink with your hand. You're going to make it worse because it still can't get out. So what I do for my concussion people is I open up the flow routes for the whole body by working from the collarbone up and the collarbone out. And that's why I figured out that massages and stuff and regular therapy doesn't work. Here's why. People just start randomly rubbing body parts
No
that hurt.
intent behind it.
Yeah. So let's say that you have let's just take two examples. I have a swollen ankle and I have a painful back. So swollen ankle, what is case number one? Painful, swollen, inflamed back is number two. So if you go in for a swollen, painful ankle, where's everybody going to start treating?
The ankle.
Exactly. Yeah. And you probably should, right?
Right.
But then I'm going to ask you, uh, where's all that swelling and inflammation from the ankle got to go when you start rubbing it?
It's going to disperse up, as you mentioned, and down. So,
Yeah, it's going to try to get towards collarbone.
ah,
And then I'm going to ask you, well, what happens if you're blocked in the lymph actually in your foot, behind your knee, in your groin, and in your abdomen and along your spine? It's not getting to your neck very well. And same thing for your back. So let's say you have a disc problem in your back, you have inflammation in your back, you have tight spasm muscles in your back.
Mm.
Where does that inflammation got to go?
Away from the source.
Same place. You point to the collarbone. And then I'm going to say, where does the blood flow to your ankle and to your back come from? Heart, right? And then how does it go from the heart to those areas? It goes down in your aorta into your abdomen and splits off, right?
Right.
But here's what people don't realize. If you're blocked in your veins and you're blocked in your lymph, your body will not let you deliver blood flow to areas to things that can't get out. Right? It's not stupid. It's not going to do it because it can't even deal with what you got. So
Right.
it restricts flow even more. So this is when everything was like, that's the answer, man. That's the answer. So I don't start in your ankle, and I don't start in your lower back, and I don't start in your brain. I start at your collarbone and I work my way out and I open those up first, then I go back. So it's the order that you do things in that determine your results of what you're doing significantly. Why? Because that, my friends, the fluid is the only transport route where anything gets anywhere that you need. That's it.
Yeah. Uh,
That's a
it,
big deal, man. That's a really
a
big thing.
really big deal.
And we just think that because it's, we don't have pain, that they're flowing well. No, it doesn't mean that at all, because the fluid flow systems, like the arteries and veins and lymphatics, they have a high tolerance for things before you know there's a problem.
Mm.
Like you'll have an issue with them for decades and you won't even know it. Well, I'll know it because I know the subtle signs to look for.
Yeah.
Uh, until all of a sudden the capacity for the body to try to heal itself on its own without your help gets broken. So the threshold of adaptation has been crossed. That's why, you can heal a cut and not think about it, because I don't have to like think about my cut healing, right?
Right. Yeah.
So that's why this threshold gets broken. And then when the threshold gets broken, the body now asks you for help. It asks you, hey, I can't do it anymore on my own. I need you to change something in your life to help me.
Hmm.
Guess what that change signal is?
It's
Pain.
pain. Yeah.
Pain. Pain comes calling. And we know that pain is not in the tissues. The pain is in the brain, right? Pain is the output signal from the brain. And then this is where I'm going to ask one question. How well do you think your ability to control pain is going to be if your brain has poor blood flow in, poor blood flow out, and is stuck full of inflammation and muck?
Yeah, you're fighting an uphill battle.
Yeah, you're not. You're
You're
not.
not
Your,
going.
your ability to inhibit pain, the pain inhibition pathways, severely takes a hit. So that's the person where anything can set you off.
Now,
Right. So that's why for me, this led me to the brain stuff,
yeah.
because I deal with people in chronic pain all the time and nothing can seem to help them. Everybody's chasing body parts. I said, first of all, you can't chase parts. You
Hmm.
have to get the fluid systems to work well, but you also have to go after the primary mechanism that controls pain. And that's the brain and the neuroinflammation. And I look back now over when I had thyroid cancer about 25 years ago. They removed my thyroid gland because it was malignant and it spread out to my lymph nodes. And they took a pretty good amount of the lymph nodes in my neck out. And at the time, I didn't think twice about it because they just sewed me up And not to mention, I had a scar tissue here that influences flow.
Yeah.
I'm like, ah, zigzag dig, I'm good. Go back to life. No, then I know now that I probably had a dysfunctional lymphatic system for years that actually caused the cancer to show up in the first place. Then they removed the cancer in the lymph nodes, but they didn't take care of the reason I got something in the first place. And then 10 years later is when the neuroinflammation and brain fog and early Alzheimer's onset symptoms started to appear. And then that's when I knew that all that time ago, the lack of me doing anything in this region led this to just, skyrocket. And I really got scared when I started to lose the function of my brain because I have an emotional trauma connection to the brain and my life because my father and my maternal grandfather both passed away from glioblastomas of the brain,
Hmm.
right? And I'm thinking in the back of my mind, with all this stuff with my history of cancer and the inability for this area to drain, I mean, I was probably on a fast track to maybe being the same.
Naturally. Yeah. Uh, and I just want to know, what do you feel are three things, if there was only three things that you could tell people about how their body and nervous system and brain work, what would those three things be?
That's a great question. Really great question. I have a few things that like three primary things that I try to help people get better at and become aware of to move the needle for everything else, all the other billion things.
Yeah.
So I try to move some of these big rocks out of the way first.
Yeah.
Right? Number one, we've covered it already, is to clear your lymphatic system. And that's why I created what's called the Big Six. That's
Hmm.
a My Lymphatic Reset program where it clears the 6 areas of your body that have the biggest lymph blocks and the biggest clusters of lymph nodes that get stuck. If you open those suckers up, that's a great step. Everything else afterwards can get better, and we can certainly review those if you like, if we have time. Number two, I talked to them about breathing, diaphragmatic breathing in particular. Okay. Trying to control your breathing, the awareness of breathing, because breathing is the number one way that you can control your autonomic nervous system. Right? And guess what moves lymphatics and body fluid a ton? Breathing. But why? Because it increases and decreases pressure every time you breathe in and out, just like a sump pump, just like a suction pump. So if you're not breathing from the right place, which means your nose, not your mouth, it means your diaphragm, the thoracic diaphragm below your lungs and above your abdomen, and not so much your lungs and your neck. Those should be second and third. Okay. That will move fluids and it will help put you into a more relaxed, calm, parasympathetic state for recovery and regeneration. So unblock the fluids and then breathe to move the fluids. Right? And number three, and here's the best part, when you clear the lymph at number one and you get your breathing down, you automatically help number three, which is to help do whatever you can to get your sympathetic nervous system, your fight or flight, hypervigilance, hyperarousal, don't die, hang on for dear life stress response system to freaking calm down and let go. Because if you don't do that, healing will be impossible. Now, from my point of view, one of the biggest reasons is this. The sympathetic nervous system controls vasospasm in the body. It controls how small your blood vessels and lymph vessels are and how big they are.
Hmm.
So when you're stuck in a sympathetic dominant hypervigilance fight or flight, they constrict. And when they constrict, you can't deliver as much flow, right? And fluids don't like it when they can't flow. And when fluids don't flow well, then you're not going to like it either because you're going to have inflammation and pain. So if I change those three things, those are the three first dominoes that help take down the rest of it. And I've been doing this long enough to know that if you skip one of those three, you're going to be treading in the quicksand and you don't know why.
That makes perfect sense, and it's in that order as well. Is the best mechanistically and to get the best result.
Yeah, I found that for sure. And here's the reason why. The big six places, the first two that you do are primary stimulation points for your vagus nerve, which is the number one nerve to put you into a relaxed state. And it's the inflammatory nerve of the body that helps control inflammation. And step number four, which is your abdomen, is the other one. So step 1, 2, and 4 of the big six are primary stimulation regions for your vagus nerve. And it just so happens, how cool this is, most of your lymphatics are located in your gut, a significant portion. It's called gut-associated lymphoid tissue, or GALT.
Hmm.
The reason that is because the gut is where most of your immune system lives. And the lymphatics are the primary component of your immune system. So if you're blocked down there, you're going to have gut problems forever. Like if you don't unblock your lymph in the abdomen, I don't care what gut program you go on, it's not working for long.
Right.
Right. And then the other place where you have a lot of lymph nodes, you've got about 600 to 700 lymph nodes in the body, those mini toilets. 1/3 of that number is from the collarbone up. I want that to just sink in for a moment and think, wow, that's like a lot. And then you think, okay, body, ask it a question. Hey, body, why in the world would you put that many things in my neck? What do you think the answer might be? Hey, man, your brain sits up there, you know. I got to make sure this thing up there isn't a hot mess. That's why. So when you rub spot 1 and you rub spot 2 of the big six, spot number 2 happens to be where the largest lymph node in the neck sits, right behind the angle of your jaw. Where what else sits there? The blood flow in and blood flow out exit point for arteries and veins. If I clog that toilet, you're going to have neuroinflammation. Right. And here's what's interesting. I speak with a lot of neuroscientists. One of my favorites is Dr. Jonathan Kipnis. You may know of Jonathan Kipnis. He studies the neuroimmune system, the nervous system and the immune system working together, right?
Mm.
And they were looking to see, to try to tame Alzheimer's with these medications. And he was telling me about a study. I can't remember how long ago it was, but they were really, really jazzed about this study. They invested a couple of $1 billion in there. And then they were happy to see that the medication was actually starting to dislodge some of the proteins in the brain. Okay. But they are linking to the Alzheimer's and dementia and stuff like that. And beta amyloid proteins, I think. So they're dislodging them. But the outcomes of people feeling better didn't change. And they're like, what the hell? Like, it's dislodging them. That's what we want. But nobody is improving. Some people actually got worse. So they killed the study. And then that's when they realized, oh, I can break it apart and stir it up, but what if it can't get out? Where's it got to go?
you
The
know,
drains are clogged. The
yeah,
drains are
the
clogged.
plumbing system is fucked, you know.
Yeah. Well, that's like what I told you with the sink analogy.
Hmm.
Like, I mean, I can have a full sink and it's full of stuff, but if I don't stick my hand deep in there and go down in the pipe, and you got different layers of pipe, that's what people need to understand. Sometimes you have to snake that pipe. You got to go in, with that long metal thing because the block is really, really deep. And that's where the deep lymphatics come into play. Those are more visceral lymphatics around the organs, and also the central lymphatics along the spine. You are not moving those through a lymphatic massage. No way. Because you're nowhere near the pipe. You have to go deep, right? And then that's where the stuff by hand comes into play, and why the breathing is even more important, because the breathing helps pull the deep blocks out.
Would that be taken care of like in a cold plunge? Is there something going on there as well if you dive into ice and then come out and take a hot shower after?
Yeah, that's a great question. It could be. So, my only caution about ice plunges is it depends on who's plunging. That's a pretty significant neurological shock to the sympathetics when you
Yeah,
first jump in there. And my patient base that are red line and sympathetics are in chronic pain.
right.
They can't tolerate a full plunge yet. It's a shock and awe.
Yeah,
You're overloading a system that doesn't have the capacity to deal with what you're sending it.
right.
And they either don't feel anything or they get way worse. So that's why I start off with smaller type plunges. Usually I start with the face first. They're doing the face, but it can help because you usually have deep blocks if you have chronic issues. If you have an autoimmune disease, I know you got a deep block. When you jump in the cold plunge, all the blood and all the fluid leaves the extremities and rushes to the midsection, right? To keep your core temperature warm. So in essence, what you did was I just opened the fire hose on the blocks. It's a reverse flow like this, a reverse pressure flow that sits in there. And then when you come out, then you'll start moving around. I don't jump you right into the hot one right away. I just have you start moving your arms and your body parts and your legs and just getting stuff to go. So
Yeah.
I'm slowly bringing you into where you can really contrast over with the heat. And then what'll happen is that I want you to envision everything rushes towards the center and floods those pipes. Then when you get out and you go hot, everything has a reverse backflow the other way. So it's a suction effect that's happening. So it's a great way to self clean your pipes, right? But here's the caveat. You never jump into the cold plunge until you do my big six first.
Fair enough.
Because you're going to manually open up the blocks. So when you get in there, you got a better chance of dislodging the blocks. That makes sense?
It makes perfect sense. A few ending questions here. I feel there's a big disbalance between this is something out of something personal is I have a hard time when I'm working with my patients. There's a balance between being relatable and being authoritative. So
Mm.
for some reason, I see a lot of doctors and they're really either knowingly or unknowingly up on a high horse, kind of looking down upon their patients. But then if you cross that chasm a little too far, then basically it's like your mom. You don't listen to your mom. You don't what she says, right? So like
Mhm.
you wanna rebel against your mom or
Yeah.
dad, whatever you want to say. So how do you play that role? Because you're extremely relatable, and I love that, by the way.
Thank you very much. That's probably one of the kindest things you could say. Well, I think part of it being relatable is because I've been in the quicksand myself.
Hmm.
So I understand what it's like to be in there.
Yeah.
So that's a huge thing right there to have that connection that can relate to someone where I know what you're going through because I've been there and I was able to grab a branch and also grab somebody else's hand who pulled me out of it. Right. So that in and of itself has to happen a lot at the doctor level of just remembering that doctor means teacher.
Hmm.
Right. And you need to have a connection with the human being carrying these body part diagnosis label things around.
Right.
Right. Like if you're a surgeon, I don't care if you're nice or not, just be really good when I'm out. Right. But everything else, that's going to make a difference in your healing. Some people got it, some people don't. Right. It is a fine line, but you have to meet people where they are.
Hmm.
So my relationship of being there has helped, but I also use the definition of doctor to help me bridge that gap where many people are scared and afraid and they just don't have enough information or they have too much information. They don't feel like they have control. So I
Hmm.
teach them. I show them these things and I explain to them exactly like what's happening to them the way I explained it to you. So now they're not so afraid because they gain control back because they have some knowledge about it. And you have to make it knowledge that you can communicate with. I mean, dump the stupid Latin names and the gobbledygook that elevates you up
Yeah.
above somebody else because
Yeah.
I don't care what you call the body part because the body part name doesn't change what you have to do with it. Okay. The names are freaking absolutely irrelevant in my world. So I do the education part and I do the connection part. And part of the reason why I don't run into that too much at my end is because people end up seeing me usually last after they've seen a lot of other different people, like a
Right.
lot.
Yeah.
All the best experts and certificates and PhDs and stuff like that. And they were often treated like that, or they're not any better. And they've been through everything, they've tried everything. By the time you make your way into me, you're pretty much open to try anything.
Hmm.
And you're much more receptive to things that initially may have looked like hocus pocus, voodoo, hoodoo, but now it doesn't. And I know it's not gonna because I'm gonna explain to you always the anatomical, physiological reason why this stuff works. So there is no, I wonder how this works sort of stuff,
Yeah.
right? So you get to see you kind of what's under the magician's table, what's going on, right?
Right.
And so they're much more open to change. Why? Because suffering has a way of doing that.
Does. It does. It can bring the best and worst out of us at different times. But
Yeah, and you also have to remember that some people might not be ready for the help yet. You help the ones that you can, you help the ones that are ready for it,
Mhm.
and those are the ones that you end up focusing on. And people come to things when they're ready for it.
That's true. I mean, the teacher, the student comes, the teacher, student is ready when the teacher comes, or vice versa.
Yeah,
You know,
exactly.
so if you could look 10 years into the future, what do you hope to accomplish as a practitioner and what is your North Star?
Ah, that's a good question. Well, I'm always going to teach. That's my greatest love is teaching. 10 years from now, I would like it to whenever I mention the word lymphatic, everybody goes, "Oh yeah, man, that big six is great." Like the lymphatic system is the best. Because right now, when I say lymph, people are like, "What? Lymph what?" They don't know what I'm talking about. And I have that in the medical community too. They're not
Hey,
even lymph.
I'm guilty as charged as well. But
Lymph's not even in the ballpark on
yeah,
them, especially in the pain world.
right.
And that's what I hope. So for the big picture, I would like everybody to be like, man, your big six changed my life. That one. And I do it every day. And the other one is to, in the professional realm, have everybody realize that all these different systems work together. We need to talk to each other, and that the lymphatic system can move the needle in all these other different systems that we're working with, from pain to neuroinflammation to immune system disorders, and even musculoskeletal pain, gastrointestinal disorders, stuff like that. It's for medicine to see that all these parts don't function in isolation. We need to stop treating them that way, because that's fantasy land.
Yeah, 100%. Very well said. Thank you for coming on this podcast and chatting and enlightening us. I'd like for you to just give the listeners who are dedicated enough to listen to all of this, where can they find you, and what's the best way of getting in touch with you and your team?
Thank you very much, my friend. I appreciate it. I'm really easy to find. I've been doing this for a while. All you have to do is type in 3 words on any search engine, and I'm going to show up probably everywhere. And those 3 words are stop chasing pain. My website will probably come up first, and that will be the branch point for all the other areas that you can go to. But I'm certainly on every social media platform that you can think of. Instagram is probably the one I enjoy the most and spend the most time on. YouTube is a close second.
Yep.
So I have a lot of stuff on YouTube that I do, but you can check me out there, and there's something for everybody.
Fantastic. Well, thank you, my friend, and hope everybody that's listening stays blessed.